Good afternoon for those of you on the eastern half of the country, and good morning for those of you out west. My name is Bob Burns. I'm the director of the National Center for Health and Public Housing, and I want to welcome and thank you all for attending today's webinar, promoting CDC tips from former smokers' materials to public housing residents. This webinar is being recorded, and resources, slides, and other materials will be mailed to you after the webinar is finished. At the end of the webinar, there'll be a question and answer session. Please don't forget to respond to our post-webinar survey. Those responses are very important to us. And I'd like to first, I guess, thank HRSA for providing funding for a part of our program so that we can do this. In addition to, I'll be thanking CDC a little bit later on. The learning objectives for today are to describe the prevalence of smoking among patients served at health centers located in or immediately accessible to public housing, to list resources available from CDC tips from former smokers campaign, and to discuss a pilot project to promote tips, smoking cessation materials, and notify interest and participation, for those of you folks who are interested, and we hope a number of you will be. Today, our presenters will be me. I'm Bob Burns, again, the director of the National Center for Health and Public Housing, and I've been involved in health and public housing now for about 20 years. We have Robin Skala, who's been involved in tobacco control for almost 20 years, and with the CDC Office on Smoking and Health for almost 10 years. Next will be Dr. Saki Malak-Cho, who is our Manager of Policy Research and Health Promotion. Saki's been in public health and previously with the Pew Charitable Trust for about almost 15 years now, I guess. And Saki will be taking us through a project and study we hope to get you involved in. Real quickly, the National Center for Health and Public Housing is focused on health of residents of public housing. We've been around for about 17 years now. Our goal is to increase access and quality of health care and trying to achieve improved health outcomes. We're trying to build capacity for health centers to improve the health of residents of public housing. We do that through training and technical assistance, research, and outreach. And we are a cooperative agreement holder, training and technical assistance cooperative agreement holder through HRSA. Of course, the opinions and information expressed today is not that of HRSA, although we are funded in part by HRSA. The agenda for today, I will give a kind of a quick overview on the policy and some of the related health facts and evidence and where we are. Robin will give a very, I think, informative presentation on CDC tips from former smokers and how you folks can use this to the best advantage to achieve smoking cessation and smoke-free public housing implementation. And last, Saki will talk about our NCHPH pilot project. We'll talk about how you can get involved and how we hope to use the information that's gathered as a study that will be part of the pilot project. And then we'll take questions and answers. To get into evidence and policy, I mean, as most of you know, we have about 1,400 federally qualified health centers serving 27 million people now. Around 350 FQHCs in or accessible to public housing, serving or providing services to about 2.7 million patients. 105 of the 341 FQHCs are public housing primary care grantees who serve about 610,000 patients. The HUD SmokeFree Rule, it seems like a million years ago, but January 16, they made the announcement at the White House. Attended that briefing and got involved in this, and it's been a great experience. It basically requires all public housing to go smoke-free as of August 1. So they are in implementation right now, and people cannot smoke in their units any longer, regardless of their situation. They have to smoke at least 15 feet from the building. At this point, I'm just going to quickly touch on poll question 1, and you folks should be able to see that on your screens, or at least I hope you can. And poll question 1 is pretty straightforward, and it's, were you aware of HUD smoke-free policy? if you could please respond to that. Were you aware of HUD smoke-free policy? And we will actually get the results. So I'm going to give you about 30 seconds to go ahead and click the button, and then we'll kind of move on from there. So go ahead and do that right now if you could. Vanessa, are you getting results?
Yes, I am getting results. And so far, we have 58% yes and 42% no.
Okay. All right. So about a 60-40 split. All right. So that's good to know. Okay. Moving on. Previous history. Prior to the smoke-free rule, about 600 public housing agencies, designated housing entities, tribally designated housing entities, had gone smoke-free, with about 228,000 public housing units involved. With the rule, 940,000 public housing units will become smoke-free, 500,000 units inhabited by elderly residents, 760,000 units with children. In terms of taking a look at the health of residents, and of course we're focused on smoking here, but it's shocking today that public housing residents, over a third of public housing residents actually still smoke cigarettes. In some of the data when this was originally put together, the number for the general public is about 22%. Recent numbers have shown the general public numbers have actually gone down more to around 14 or 15%, and yet the public housing numbers are still very high. And you combine that with some of the comorbidities involved. You've got a number of folks who have diabetes, almost twice the national average, COPD, almost twice the national average, asthma, almost twice the national average, and it's not a good recipe for healthy outcomes for residents of public housing. In terms of public housing primary care grantees, here are some numbers regarding patients with smoke-related illnesses. About 56,000 with diabetes, 56,000 with depression, 34,000 with asthma, 110,000 overweight and obese, in addition to the tobacco use problem. So it's a significant issue and one that really needs to be addressed. In terms of the services provided by health centers, in our recent survey, about 72% doing on-site pharmacological, about 82% with non-pharmacological or counseling. About 75% of health centers provide both, and about 95%, almost all, refer to outside services. In terms of who is actually providing smoking cessation services, surprisingly, it's still the physician who's probably the lead, and then it kind of goes in order: from physician, nurse, physician assistant, case manager, nurse practitioner, community health worker, tobacco treatment specialist, and an outreach worker. Okay, now we're on to poll question 2. So if you could respond to this, we'd appreciate it. Do you have a tobacco treatment specialist or peer specialist at your health center providing tobacco treatment counseling or cessation counseling? Yes, no, or I don't know. And again, if we can get that, we'll give you about 30 seconds to respond to those questions, and we would really appreciate the answers. Gives us kind of a sense of what people in the field are really experiencing. And Vanessa, just let me know when you've got the results, and why don't you just go ahead and once you get it, why don't you just announce the results.
42% says yes, 33% say no, and 25% I don't know.
Huh. Okay. All right. Very good. All right. In terms of opportunities for health center involvement during implementation of the smoke-free ban, we've been kind of surprised in some of the polling that we've done how few people have been reporting that they have been working on implementation of the smoking ban, and some of that we think is the nomenclature in the question. But some opportunities are providing health center information and services during the time of the lease signing, meeting with resident advisory boards, providing materials and education on smoking cessation services in the public housing buildings, to target smoking cessation support to violators of the policy. Again, when we're asking that question, we're not assuming that, obviously that a health center, for example, is going to do enforcement. but they could do education, they can do treatment, they can do all kinds of things to support successful implementation of the smoke-free ban. Poll question number 3, are you working with the PHA on the smoke-free policy in any way? So in any way, again, not saying are you, taking on the responsibility of implementing the smoke-free policy, but are you and your organization working with the Public Housing Agency in any way in helping with the implementation of smoke-free? So again, yes, no, and I don't know. So again, we'll give you 30 seconds. And again, Vanessa, if you can make the announcement.
27% yes, 27% no, 45% I don't know.
Okay, all right, very good. Okay, well, very good. At this point, I'm going to turn it over to Robin Skala from the Office of Smoking and Health at CDC. So Robin, take it away.
Great. Thanks so much, Bob, and good afternoon, everybody. Hopefully you can hear me clearly. Let me just pull up my slides here. So thank you to our colleagues at the National Center for Health and Public Housing, and to all of you for joining us today. I'm very pleased to join you and to provide an overview of CDC's Tips from Former Smokers campaign and share ways that you can use the Tips campaign and its resources in your efforts to promote and support quitting smoking. So today I'll give you some background about the Tips campaign and its impact to date, and then I'll provide a brief overview of the 2018 Tips ads and media buy, which are on air now. I'll tell you about our efforts to reach smokers, and then I'll review our free and low-cost Tips campaign resources and ideas for how they can be used in your work as part of this effort, and generally, because a lot of folks have had much success doing that. So the Tips campaign features real people living with smoking-related diseases, and many of the people that we feature started smoking in their early teens, and some were diagnosed with life-changing diseases before they were even age 40. And 2018 is the 7th year that the Tips campaign is on air, and our formative research has helped shed light on a few key insights that helped make the Tips campaign successful. First, our ads focus on living with the health consequences of smoking rather than dying. Second, they instill a sense of urgency to quit now rather than later. Third, they provide new information linking smoking to health problems they may not be aware of. And then fourth, they share free resources to encourage people to quit. So this year, the Tips campaign is featuring a combination of ads from previous years as well as new ads that were recently created that focus on health issues caused or made worse by smoking or exposure to secondhand smoke. And those include everything you see here on the slide, and also not on the slide, and I don't know why they're not on the slide, I'll have to add them, are HIV and mental health conditions, specifically depression and anxiety. And I know, Bob, that you mentioned depression and anxiety about an issue that's prevalent within this population. So we know our approach is working because every time our ads air on TV, calls to the toll-free quit line numbers increase greatly. And in addition to quit line call volume as an indication of success, we have published articles on other outcomes. For instance, as you see on the slide, from 2012 to 2015, CDC estimates that millions of Americans have tried to quit smoking cigarettes because of the Tips campaign, and at least 500,000 have quit for good. And the campaign also encourages non-smokers to get involved. In the first year of the campaign alone, back in 2012, an estimated 6 million non-smokers talked with friends and family about the dangers of smoking. Tips is cost-effective. An economic analysis of the Tips campaign has shown that for every $2,000 we spend on the ads, we prevented death. And we do have a handout along with a number of other handouts on the handout portal about the impact of the Tips campaign. So this year, we have new ads featuring Tips ad participants from previous campaigns, as I mentioned, highlighting new aspects of their health conditions or stories. And those ad participants are featured on this slide, and I'll briefly tell you about them now. I don't know if you've seen these new campaign ads or not, but Brian on the upper left started smoking before he was a teenager, and he had a heart attack at 35 while he was in the Air Force. and has had serious health problems since. And he most recently had part of his lung removed due to lung cancer. And he has a new ad titled Now You Know that talks about all the serious health problems he's had due to smoking. Christine in the upper right started smoking in high school, and she was diagnosed with oral cancer in her early 40s, and she lost her teeth and had half of her jaw removed. She has two new ads. One is titled Smoker, and in that ad, she says, if you think this could never happen to you, think you again. If you smoke, you're a smoker. And then in her second new ad, Oral Cancer Effects, she talks about how oral cancer treatments and reconstructive surgery have affected her appearance. Sharon is in the bottom left, and she started smoking at 13 in her late 30s. She was diagnosed with throat cancer. And then after several surgeries, chemotherapy, and radiation, doctors also had to remove her voice box, and she now breathes through a hole in her neck called a stoma. And in her first ad called Treadmill, she talks about how her life is almost back to normal. And then she has a second ad titled Ways to Quit, where she and Tiffany, who's in the bottom right, talk about the importance of quitting, and they share successful strategies to help people quit for good. And then Tiffany, who I just mentioned, her mother, who was a smoker, died of lung cancer when Tiffany was 16, but like so many people featured in the TIPS campaign, Tiffany started smoking in her late teens, and she quit smoking in 2012 when her daughter turned 16. So that's a little bit about our new ads. For the media buy, we are on air this year for 25 weeks. We launched on Monday, April 23rd, and then our ads will run until October 14th. We have ads on national television, and we also have national digital efforts. For our TV ads, we do rotate the combinations of our ads approximately every 4 weeks. We also have additional TV placements in 37 local media markets, in addition to our nationwide national ads. In 37 local media markets, we place ads, additional ads, because those markets have higher smoking prevalence. And then we also have other ads to reach targeted populations. So for instance, we're running Spanish language ads on Telemundo and Univision and Linea de Ayuda segments in 25 markets to reach LGBT audiences. We're running TV and digital ads and ads in national LGBT magazines such as Out and Advocate, as well as print ads in at least 48 local markets surrounding Pride events. And then to reach American Indian, Alaska Native audiences, we're running radio, print, and digital ads in targeted locations and ads on TV screens and clinics through Good Health TV. And we're running print and digital ads in 24 markets with large Chinese, Vietnamese, Filipino, and Korean communities. We began our 2018 efforts to reach HUD audiences impacted by the smoke-free housing policy with new digital ads on mobile devices that encourage them to visit the TIPS campaign website's quit page to learn more about how they can quit smoking. And these audiences are being geo-targeted within a 1-mile radius of these HUD housing locations. And these ads will run for the duration of our campaign throughout mid-October. And then on the slide, you can see these are just a few selections from some of our new digital ads. And some of the language has changed slightly since now that smoke-free housing policy deadline passed. So instead of saying your building is going smoke-free, how about you? Some of them say, your building is smoke-free, how about you? So we did change that nomenclature after July 31st. And this isn't our first effort to reach public housing audiences. We actually have had specific efforts to reach them since 2016. So just want to mention that these are this year's efforts. Our TIPS campaign website, cdc.gov/TIPS, has a variety of information and resources that you can use in your own media and communication efforts, and you can see what some of those media and communication materials are that you can find on that website. Highly encourage you to visit the website and take a look around because there are so many information and resources that are available. The TIPS website also has partner pages that I want to call your attention to with free tools and campaign materials and resources to help people quit smoking. And you can access the partner web pages from a link at the lower part of the main tips page. You basically scroll down and there are other links to click beyond the main page that I showed you in the previous slide. And we have pages for several types of partners, as you can see here on this slide: faith-based organizations, healthcare providers, and that's a little screenshot of the healthcare provider page, and you can see it's broken down into even pages for mental health professionals, pharmacists, vision professionals, as well as general health practitioners. We have a page for organizations serving military members and veterans, a page for organizations serving public housing residents, which have great resources. I encourage you to visit that page. And then a page for partners in public housing and public health professionals, sorry. And so all of these pages have excellent resources that you can use in your work. So definitely check them out and scroll through and see what would be helpful to you. These are the cessation resources we promote as part of the TIPS campaign. And they also include new quit pages that were shown on that cover slide I showed you previously. But the free cessation resources that we highlight include quit lines, such as the 1-800-NOW quit line portal connects callers to their state quit lines. 1-855-DEJALO-YA provides help in Spanish, and the Asian Smokers Quit Line provides help in Asian languages: Mandarin, Cantonese, Korean, and Vietnamese. And then the National Cancer Institute's text messaging services and smokefree.gov, as well as NCI's online quit smoking support site, are also available. I do want to mention that state and local health departments are also a great resource to help all of you. If you don't work with them already, we highly encourage you to get in touch with them, and you can find your state health department contact information using the Tobacco Control Network State Directory, and then local health department information can be found using the National Association of County and City Health Officials Directory of Local Health Departments. And there's a handout on the web platform that contains resources, and this information is included as part of those resources. And we at CDC's Office on Smoking and Health are also happy to make any connections you need. I also want to show you that we developed these TIPS posters focusing on support of cessation and secondhand smoke messages in English and Spanish. And these posters are available to download for free placement and use from our TIPS Campaign Download Center, which is where you can find all of the TIPS resources you can choose if you choose to participate in this project, or just generally speaking, we make this download center available for folks to go and download TIPS campaign ads as is. If anyone wants to customize the TIPS posters or materials, there's another place to go for that, and that's the Media Campaign Resource Center, and I'll talk about that in a couple of minutes. So CDC, as well as state and local health departments, have previously worked with community centers, health centers, WIC clinics, and other groups to place TIPS posters in these community settings to encourage smokers to quit, start a conversation about quitting smoking, and let them know about the free resources available. And this is a really powerful intervention, so we're pleased that you are interested in this. A 2017 collaborative project between the Office on Smoking and Health at CDC and NACHO, who I mentioned, the National Association of County and City Health Officials, focused on partnering with community health clinics to hang TIPS posters and place TIPS videos in healthcare locations to encourage healthcare providers to talk with their patients about quitting and provide smoking cessation resources. And this effort significantly increased the number of cessation conversations in the clinics. And just so you know that we do have evidence-based smoking cessation intervention resources on our healthcare provider pages if you'd like to look into that additional information as well. So we're really excited that you are interested in securing these types of placement and support in your community locations as well. So I mentioned all the great resources we have to educate about secondhand smoke and encourage and support smoking cessation, and here's where you can find them. So the TIPS website I talked a little bit about already, cdc.gov/TIPS. You can find free digital social media, and print materials. In the center, and I'm going to talk more about this in a moment, is the Tips Download Center at PlowShareGroup.com/CDC Tips. And that's where you can find tips resources for free placement. You can download them and use them as is. They have a CDC logo on them, and you can use them for free placement. There are posters, billboards, cessation flyers, and then last, all the way on the right, is the Media Campaign Resource Center, which is where you go for customized ads if you're going to pay for placement. And we can help you with that if you want to change the tag or any information on them. There's a nominal fee for that. Our resources help smokers quit and educate smokers, their friends and family, as well as public housing residents about the dangers of secondhand smoke. And we're hoping you can use these and share these with your colleagues as well. So this is just an at a glance. I know you have a copy of a PDF of this presentation that will be made available to you. And this just basically breaks down in a different order the Media Campaign Resource Center, the Download Center, and the website, and where you go for what. Because as I mentioned, they are slightly different. So we want you to have a good understanding of where you go depending upon your needs. So next, I want to provide a step-by-step review of how you can download the free Tips campaign materials from our Tips Download Center that's located at PlowShareGroup.com/CDC Tips, and that's our campaign contractor site. And you can see that address noted on the bottom of the slide. And this is where all of you would go, since these are the as-is Tips materials that you can use for free placement in your healthcare provider locations and community locations. So this is the main page of that particular site. It does take a minute to load. So once you type in the address, you're going to have to wait about a minute. You'll see your system spiraling a bit until the actual page will shift from a version that's similar to this to what this slide looks like. I also want to mention that there are people that you can contact for additional assistance at any time if you need anything related to this site, if you're having trouble using it, if you need something that you don't see on the site, whether it's a particular ad or a version of an ad to work with your systems. If you're doing like low resolution video, print should be pretty easy to click and download. So I just want to tell you that there are people that can help you listed on this page. And of course, if you need assistance, we're happy to help you as well. So you type in the URL, wait for the page to load, as I said, and then you'll see the main page. So across the top there, highlighted in red, you'll see tabs with the different categories of campaign materials available on the site. And you can click on the tab that includes the materials that you're interested in. I would imagine you'd start with print, so that's a good tab to start with. But we do encourage you to click through all of them to see the different ads available, since not all of the ads are available in each format. Like, we don't have everything in a print version that we have in an at-home version. So you'll want to click around. You see that HUD tab? I mentioned to you that we had those posters under a HUD tab. That includes some of those posters that I showed you before that we've used for to reach public housing residents. And you can use those for many different purposes, not just smoke-free public housing, but we use them for that purpose, which is why it's called titled HUD, because we use them for our 2016 efforts. And it includes our smoke-free quit flyers as well. So next, in addition to the tab across the top with the ad formats, they're also organized by year. And I realize that's not intuitive to all of you, because you don't think back to be like, oh, Roosevelt's heart attack ad, that's from 2012. You wouldn't know that, so you'll want to click on each year's tab, because that was the most logical way for us to organize it on our end as the ads came out. And that way you can see which ads are available from each year in a particular section. And as you can see on the bottom of the slide there, you can click the visual to preview a thumbnail, but you also see they have different sizes if you were placing it in like a flyer or a newsletter or something like that. It gives you different sizes. So those are the little boxes that you'll want to choose for what you're interested in that you'll download thereafter. So you click the boxes for the ads you want all across the board. You know, wherever you see something you like, you click on it, and it's free. So click whatever you'd like. And then once you do this, you'll start to see the items added to your basket. See the little basket thing in the second section there? It says 2. You'll also see a little notice about the expiration dates, and you'll need to scroll to the bottom to accept that you agree with the expiration dates on there too. And then you'll see your list. So you click the blue down triangle to download each file, and the next screen depends on your browser, but your file should then be downloaded onto your device. And as I mentioned, if you're having issues or you need something special, you can contact the PlowShare Group contacts listed on the homepage for assistance. So I hope that's a helpful review of how the download center works. Once you get in there, it's pretty intuitive, but we have this as a handout as well in case you need to double check how to do this. So in closing, I also want to mention that you can follow us on our social media platforms and engage in the conversation at CDC Tobacco Free. You are welcome at any time to share and repurpose our social media posts in real time, or the historical posts are there too if you think that you would find those helpful. And then last, in a very fancy way, here is my contact information, as well as contact information for my colleague, Shelly Hammond, who I work closely with. And we can help you if needed. But for general tips campaign inquiries, we have an email for that, and it's tobaccomediacampaign@cdc.gov. But if you needed help with anything that I just talked about today personally, Shelly and I would be happy to help you. So that's my presentation for today, and I will turn it back over to Saki from here.
Hi, thanks so much, Robin, for all of that great information, and thanks to all the participants for joining the call today. We think that the CDC Tips campaign is great, and that's why we're working with the CDC to educate, hold on. Oh, there we go. To educate providers about the TIPS campaign materials and to promote the use of these materials to increase access to smoking cessation for public housing residents if and when they decide to quit smoking, particularly at this time while HUD has implemented the smoke-free policy in all of public housing. As Robin mentioned, the CDC TIPS campaign has been evaluated, and smokers that have viewed TIPS materials before have reported greater intentions to quit smoking. So we anticipate that this material will be a valuable resource for health centers that are located near public housing. And we're also interested in increasing the tools and materials that are available to healthcare providers that could benefit all of their patients. We also plan to evaluate the usefulness of the CDC TIPS material and the TA we provide as part of this pilot, and we'll be measuring changes in the amount of smoking cessation counseling occurring at the health centers that could be attributed to this introduction of the TIPS resources. So I'd like to just go over the basics of the pilot project. We will be selecting 3 to 5 health centers to promote CDC TIPS campaign materials. And as a participant, health centers will receive training on the TIPS campaign, technical assistance, and ongoing support for a 3-month project period, and a small stipend to offset the cost of printing. Participants are responsible for placing materials in the health center, educating and training staff to use the materials, and that education and training can occur during our technical assistance and follow-up calls. And we're asking that health centers provide some baseline data and follow-up data to inform our evaluation. So this is an overview of the pilot project timeline. So in August, today we're having the kickoff webinar and solicitation for participation in this pilot. We're asking any health centers that are interested in participating in the pilot project, let us know at the end of this webinar, and instructions for that will be on a later slide. We plan to select the sites and notify participants by the end of this month, and we'll be beginning some of that baseline data for evaluations. In September is when the training and the TA will actually begin. The first week we'll have our first TA call, and this call will be tailored for each health center. We'll work with the health center to create a plan for what types of materials are appropriate for each center and where they should be placed, and the types of trainings and education that's needed for staff. In October, we'll follow up with each center to find out what's working and discuss any challenges or needs that arise. And then in November, we'll wrap up the project and have a longer final evaluation call and survey and follow up with the participants. The results of the pilot project will be published in a report, and it'll include case study write-ups, and it'll be disseminated widely to health centers and available on our website. So to qualify for this pilot, participating health centers, we're asking that they're new to using TIPS material, and consideration will be given to health centers that are located in areas with high smoking prevalence rates and where there's a high need for smoking cessation materials and some geographic diversity. So if you are interested in participating in the pilot, you can let us know by filling out the post-webinar evaluation survey or by sending us an email directly. The deadline for participation is August 24th. And if you aren't selected for the pilot at this time, you don't have to worry. There's a possibility of additional funding in the future to support a second round of a pilot. And you can always contact us if you need help on this or any other issue actually that you face when you're providing care to public housing patients. These are some of the resources that are available on our website from our partner organizations on smoking cessation. We have a smoking cessation resources widget that you can click on, and some of the CDC tips information is on there, as well as information from HUD. If you join our mailing list, you can receive updates on HRSA, funding opportunities, other resources and services and webinars that we hold. And here is our social media information and the contact information for Bob, myself, and Robin. And I just wanted to remind you that the handouts that Robin described are available through the webinar platform, and the PDF of the slides will be provided later through an email follow-up. And thank you so much. We are going to open up for question and answers. Some brief instructions. If you would like to ask the presenter a question, you can please submit it through the question box on your control panel. And if you are dialed in through your telephone and you would like to verbally ask the presenter a question, you can use the raise hand icon on your control panel and your line will be unmuted. As we begin this Q&A period, I know that we've already had some interest in participation, and I'm going to open up the line and ask anyone who has interested in participating, if you could please share with us why you think it's important for your health center to have these tools and what you hope to gain from participating in this pilot. So I'm going to open it up.
Hi, this is Barbara Willis. I'm in Portsmouth, Virginia.
Hi,
but I have a
Barbara.
question. I have a question.
Okay.
I'm trying to understand, I mean, the material and all that's great. Where our health center is housed is among 752 unit public housing residents, and not everyone comes to our health center for services. how can we reach a broader mass of folks without trying to distribute literature at every door? I like that you have the commercial campaigns, but could we get funding so that we could do something more local in terms of being able to utilize that type of media to reach more residents?
Okay, I'm going to hand that question over to Bob and Robin.
Well, from our side, you know, obviously, and unfortunately, we don't, you know, control funding, you know, for that kind of thing. I don't know if CDC has funding available for that kind of an effort. And I'm curious, are you trying to do kind of more education and outreach and information, or are you really trying to eventually get to treatment and counseling and that kind of thing?
My preference is to get to the treatment and counseling, but it's kind of hand in hand because with regards to the education and outreach, because you're dealing with different age levels as well, as shown in your by the people that you had selected to participate in your campaign. Some folks started at age 14. Some folks were, you know, earlier in life, different scenarios in that respect. And so, you know, one of the things that I see with regards to the population being served, they get inundated with paper.
Yep.
And it's minimal in terms of what they actually pay attention to and or absorb. And so looking at social media outlets as well as television during the prime times for them, and especially if it could be geared for being more recognizable for them, so that it hits home, and also to get into the schools where the children are going. That's the reason why I'm asking for, you know, let's get with the digital age. I mean, it's a lot of printed stuff there, which is great, but you have to be able to have people that will be open to absorbing it and to reading and to, you know, to looking at it.
Right. So, Bob, do you mind if I chime in? Hi, Barbara. This is Robin.
Yeah.
CDC.
Mm-hmm.
So we do have digital media efforts, social media efforts, and our campaigns are on television nationally for 25 weeks this year, including now. So we are reaching people in some of the locations and formats that you talked about. So we are reaching them with our ads, and these are just efforts to complement what we're doing nationally and in some of those 37 local media markets that have higher tobacco prevalence, where we're on TV and, you know, we're in the community. We have a digital buy. We're on social media. So these are just efforts to complement what we're doing in public housing, within the community, and in these health centers, to prompt conversations about quitting when you're in the health center or, you know, in the community, if you want to have additional placements. I know that many states and localities also have tobacco prevention and control efforts. They promote cessation resources. They educate about secondhand smoke. So these are just resources that we're highlighting that are free, that you can use to complement these more broad, expensive efforts that we're doing. And so when you place TIPS campaign posters, just because it's turnkey and easy, in a waiting room, or you put our ads on the looped, you know, on the closed caption TVs, or you put a poster inside an exam room, then that way patients see the TIPS campaign materials and messages, and, you know, they can focus on them because you are alone in the room for a bit, and then it does prompt conversations about quitting smoking, because you are seeing these smoking cessation resources, in addition to the ads reaching you that we're placing 25 weeks a year in some of the channels that you talked about.
And just to piggyback, Robin, on what you just said, I mean, you talk about placing, printed materials, in waiting rooms or exam rooms and that kind of thing. But, if you can coordinate, and this is, important, if you can really coordinate with your public housing agency and place some of those same printed materials, in the public housing development, or in any of the public spaces in the public housing development, depending on how it's set up, so that folks can see them there as well. And one thing that I really encourage, in general, is if I know that your initial point is that all of the residents of the public housing agency are not actually going to your health center for services. But, one great thing might be if you could work with your public housing agency, because each public housing agency meets with a resident usually once a year. And as they go through kind of the checklist of items that they address, if healthcare can be one of those items, and if smoke-free can certainly be, on that list. And again, either they could refer them to you for services, or provide information, any of the information around smoke-free, or any of the tips information. It would be, tremendously valuable.
Okay. Well, thank you.
Okay, you're welcome. Any other questions? And Robin, can I throw a question out to you?
Gloria is next on the line for a question.
Oh, okay, go ahead. I'm sorry. Yeah, I don't want to interrupt anybody. Go ahead.
It's okay. Hi, my name is Gloria Zapata. I am a mental health counselor and tobacco treatment specialist down here in Miami. I work for Brinket Medical Center. And my question is about the project. So the center that will be chosen, besides receiving the access to these resources and these materials that I find that they're great, what other support is the community center will be receiving? I'm asking about the NRT products or something else to work with the customers that comes to the community clinic.
Do you want to address that from your perspective, or do you want me to address it generally? And thank you for your question, Laura.
Yeah, I think it's a great question, but I think there are two different things going on. I mean, in one sense, we're talking about informational resources, and in the other, we're talking about actual treatment. The list of medically assisted treatments is long, but health centers in general are geared up to handle that. I think some of the issues around whether or not the treatments are paid for and covered has a little bit to do with whether or not you're in a Medicaid expansion state. But in general, health centers are going to work with patients to provide the various treatments, whether it's Chantix or on the MAT side, or NRT side, nicotine replacement therapy side, or if it's counseling on the other. And I'm sorry, Robin, go ahead.
Oh, no problem. I was just going to say that that if you use the TIPS campaign posters and resources, you'll see that they have a call to action on them. Some of them say you can call 1-800-QUIT-NOW, and so folks that are in Miami would call the Tobacco Free Florida quit line just by dialing 1-800-QUIT-NOW, and whatever resources they would have available if they choose to call a quit line would be, which is usually quit line counseling. Sometimes they have additional resources available too, would be provided to them. But as far as what resources you provide would more relate to what Bob just articulated.
Okay, because currently I am doing the individual sessions and also I'm doing the groups. So through AHEC, I'm receiving NRT products, lozenges, gum, and the patches. As well, I'm doing the 6-week counseling sessions.
That's terrific. So you do have funding provided to enable you to do all of that, you're saying?
I have the support from AHEC, so the company doesn't have the own funds to buy the NRT or to provide that to the clients. So we are doing that through AHEC. So my question was about if the campaign will provide the NRT. That was my question.
I think the answer is unfortunately no.
Bob, you can let you it. Sorry.
Yeah, from the health center side, I think the answer is TIPS itself does not provide NRT. It provides information and links to organizations that provide different services. But in terms of NRT and other treatment services, I mean that's something that each health center provides or each clinic provides, and it's just that the level of reimbursement for some of those services may vary depending on whether or not you're in a Medicaid expansion state.
Okay, I understand. Yeah. Okay, thank you so much.
All right, thank you. And Vanessa, do we have anybody else listed?
Yes, we have another question from Katie.
Okay.
Oh, hi. Didn't know I was on. I was just wondering if the smoking policy includes vaping.
So the HUD rule doesn't address vaping. The public housing authorities on a case-by-case basis are deciding whether or not they want to include e-cigarettes or vaping. So it's not, so all of the PHAs are required to stop the use of tobacco and also water pipes. But I know many of them are also including vaping and e-cigarettes, but not all of them.
Okay, all right, thank you.
Welcome. Vanessa, are there any other questions? I don't see it on my screen.
No, there are no more questions. We have one more from Kristen.
Kristen, do you have a question?
Okay, let me read her question. What about medical marijuana card users? She's asking regarding the medical marijuana cards users.
That medical marijuana use is allowed on public housing property. I'm not sure. Bob, do you know the answer to this question?
I think it's another one of those up in the air things.
I'm not exactly sure. We can get back to you and find out whether or not.
Yeah, because some of it has to do with the federal law versus the state law and the conflict there.
Right. It's a federal.
It's illegal federally, I guess, isn't it?
Hi, sorry. This is Jose Leon, Chief Medical Officer for the National Center for Health and Public Housing. The HUD rule states that the use of marijuana is prohibited. And however, in regards to marijuana that is used or is prescribed, that's something that the public housing agency needs to work on, and that is all on a case-by-case basis according to the HUD rule.
Jose, do you know if they have they come out with any best practices on that yet?
And no yet.
Not yet. Okay. Vanessa, any other questions?
No, we don't have any more questions.
Okay, so I just want to just throw a question out to Robin, and you talked a little bit earlier about the use of tips improving the efficacy of cessation efforts, and I'm wondering if you have any numbers to kind of give us an idea of how much more successful they can be if tips is involved.
In this particular instance, because I had talked a little bit about the TIPS impact, which you can find on the cdc.gov/TIPS website, and that talks about the TIPS campaign and the results that we've been able to achieve and discern from our evaluation efforts.
Yep.
So I did, I'm looking through to be able to highlight for you without sharing my screen again.
Sure.
The results that we have had. I'll tell you that, did you upload those NCHPH case studies?
We did.
Okay, the success stories. So on the platform, the NCHPH success stories from the individual local health departments as well as NCHPH's final report, they talk about how the TIPS campaign resources and the evidence-based smoking cessation interventions that they talk about how those increased when they added the TIPS campaign resources to their health centers and then made specific efforts to have these interventions with their patients. And they saw a 20 to 200% increase depending upon who they are and what they were able to.
That's great.
So that's, related to, the potential that we saw from that pilot project in those particular instances. But as far as the TIPS campaign goes, I did talk about a new study that came out that's on our TIPS impact and results page, that from 2012 to 2015, we estimate that millions of Americans have tried to quit smoking because of the campaign, and at least 500,000 have quit for good. And so even during 2012, our first year of the campaign, an estimated 6 million non-smokers also talked with their friends and family about the dangers of smoking. And then we talked a little bit about the cost effectiveness. But, the NCHPH, the success stories from the local health departments that you posted and the NCHPH final report do give pretty good insight about how these posters in health centers complement our national digital and television and other efforts that we have to help provide interventions in your healthcare locations. So anything all of you could do to get involved in this project with the National Center for Health and Public Housing, or just generally on your own, adding these these posters or the videos in these healthcare locations or other community locations really helps to educate folks about the dangers of secondhand smoke, the dangers of smoking, the benefits of quitting, and the free resources available. So,
okay. And Robin, do you guys have any data on, comparing the efficacy of print materials versus the electronic materials and videos?
So there is some data. We have more information about what we're able to measure from ads placed on national television at CDC best practices levels, at certain gross rating points. So we have evidence related to that, As far as the print materials, they are complementary. So they're, you know, complementing what we have, and that's not as measurable. The only measuring you could do is, you know, I mean, there is some evidence about how if people see additional ads in other locations, you know, like out of home, billboards, bus shelters, within the community, it further supports and helps with message resonation. So there is some data on that, but it's really just information that complements what we have out there that people are able to see and understand, and then those evidence-based cessation interventions that you can provide in these healthcare locations. You know, it's just in a different capacity.
And can you talk just briefly about, you know, for those who are, you know, technophobes like myself, about the I guess the technical assistance available, and also the ease of use of the you know, the electronic and video media that you guys have created.
Right. The download center, other than the fact that it sometimes takes a bit to load, people generally don't have issues with poking around and picking the different sizes of the materials that they want and downloading them, whether it's to a thumb drive or to their laptop, or, you know, and then uploading it, if it's a video, to their device, or, you know, printing out the materials. They're in different sizes. Some you can print on a regular printer. Some you have to take to somewhere if you want to print it larger in color, depending upon what type of resources you have in your offices. But it's pretty intuitive. I'm able to use it. I'm not very technologically savvy. But if anybody needs help, there are folks that can help them. You know, we can help you. There are folks that operate that site and provide those resources that can help you. So don't let that stop you, because you can always ask for help, and we're happy to help you.
That sounds great, Robin. Well, listen, I think the hour's just about up, so I was just going to turn it back to Saki just for one kind of final closeout, and also in case, Saki, you want to you know, request anything specific you know, from the audience, especially those who are interested in attending.
Sure. Thank you so much to everyone, to our panelists, to Robin for the description on the CDC tips materials, and to all of the participants. Like I said, when we close out, you will receive a post-webinar survey. If you're interested in participating, that's the place you can let us know, or send us an email. So thank you so much. We look forward to hearing from you. And that's it. Thank you.
Thank you very much. Now, take care.
All right, bye.